Now, when we have a patient of acquired immune deficiency syndrome or a person who has contracted HIV, that is the human immune deficiency virus, there are a lot of neuropsychiatric complications that the person can encounter. We have basically categorized these complications into the complications that are affecting the personality of the person, and usually it is the person is seen to be an apathic person. Loss of libido is observed in such people, and loss of energy or inertia is observed in such people as well. All of these symptomatologies are quite prevalent, and on the other hand, there are the cognitive impairments that are also observed in such patients, ranging from delirium or dementia that is quite related to the HIV or the acquired immune deficiency syndrome. On the other hand, we have the other complication, which is again relating to the neuropsychiatry. It's basically the depressive episodes that are seen in patients who have contracted HIV or they are suffering from a full-blown AIDS, that is the acquired immune deficiency syndrome after the contraction of the HIV. So we are discussing this depression over here in this section particularly, and what are the causative factors for the development of the other neuropsychiatric complications as well in this section particularly. The considerations, the important major risk factors that are to be considered, that will be discussed over here in this section. And then we'll be also discussing or giving you an overview regarding the treatment modalities, particularly to these neuropsychiatric complications and even the disease of the HIV or the syndrome of AIDS, that is the acquired immune deficiency syndrome. What are the different kind of treatment modalities that are present for the betterment of the patient, that will be discussed over here in this section. Discussing depression, there is a differential diagnosis of DUO. So what is DUO? DUO is basically a diagnostic test that is performed in the HIV patients for the presence of the HIV-1 virus, and then we have the HIV-2 virus, and it can also be for the calculation of the P24 protein. That is again quite significant for deciding the treatment modalities in such patients. So if you have a positive DUO test that is being performed on a patient, there should be an adjustment response that should be kept in mind as well. And then we can have an organic secondary to HIV related disease. In these patients, even the DUO is found to be positive in such patients. And then we have the medications and its complications as well. The antiretroviral complications are again very important and very significant, and they should be critically noticed in a person who is on the antiviral treatment. Then we have the psychiatric disorders on the other hand. So this is the differential diagnosis of a positive DUO. It can be an adjustment response, it can be an organic disease. On the other hand, it can be a complication of a medication even, and it can be a psychiatric disorder. So these are the differentials, and when you have the positive DUO, you have to further investigate the patient to get to know out of all of these differential diagnoses, what is the final diagnosis in that particular patient that we're talking about. Maybe more common in gay men regardless of the HIV, the lifetime prevalence in gay men of major depression is 33% versus 3% in normal individuals. So maybe it is the contraction of the HIV that is making the people, that is making the gay men more prone to development of the depressive disease. The substance misuse is again more common in the patients of the HIV, that is basically 45% versus 15% in the normal individuals. So these are the different researches that have been carried out on the patients of the HIV or on the patients of the acquired immune deficiency syndromes, and that is basically how we calculate all of these criteria or all of these ratios between the normal men and between the people who have contracted HIV or AIDS. The considerations that are to be taken into account are the onset and the course of the disease. So one should know whether it is an early onset, whether it is the middle or the late, depending upon the CD4 counts as well. And then only you can basically consider the complications of such a disease. The symptoms and the severity of the disease is again very important. Having the CD4 count levels above 500, even if the patient has contracted HIV, he or she may lead a normal life, and this awareness should be given to the patient as well, just to make him just to make him come out of those depressive episodes. So the counseling sessions are the mainstay over here. The cognitive behavioral therapies have been carried out coupled with the medications as well. The previous episodes and the treatment responses should also be noted down in these patients, just to get to know the patient well, and just to get to know what kind of a treatment modality should be designed for that particular patient whom we're talking about. So the treatment modalities over here are the controlled trials that are being carried out, and they suggest the standard antidepressants have the usual efficacy in these patients after they have contracted depression, as well as they have HIV or AIDS. On the other hand, the anecdotal evidence for the replacement therapies, for example, testosterone is sometimes given to these patients, and it has been obviously on trial basis, but still the outcomes have been quite positive and quite promising in these individuals. So the psychotherapies, they sometimes prove helpful for dealing with the loss, etc. Obviously, it can be for any person who is suffering from a terminal sort of an illness. The psychotherapies or the cognitive behavioral therapies have been designed for these individuals. The stimulants useful in the advanced illness are again very important, and sometimes the mood elaters or the mood stabilizers, for example, lithium is even indicated for such patients who have these mood disorders and they're suffering from some terminal sort of an illness. Stressful life events, coping in health and illness projects, that is CHIP at UNS. So CHIP was basically a project that was carried out at the UNC and was basically coping with the health and the illness in these patients who are basically suffering from the terminal illnesses. 9-year longitudinal study was being carried out, and it was basically a comparative study that was being carried out on such basis. The life events and difficulties was basically interviewer based. Severity, duration, and the context was very important over there. It excludes the events due to the HIV. So it's basically not related to the disease process itself, but indirectly the stressful life events that are taking place in the life of the individual after the contraction of the HIV, and how that person is basically coping up with those stressful life events is again very important. CHIPS was carried out. It's basically a research work that was carried out at that level at baseline severe life events in the previous 6 months, and how it is basically relating to the low levels of the natural killer cells, that is CD16 and CD56, and fewer CD8 cells. So even the stressful life events in the life of a person can affect the immune system of that person, and that was basically a study that was carried out, and it was basically a 9-year-old longitudinal study and research work that was quite promising for the patients who are suffering from AIDS or HIV. So in this section particularly, we talked about depression and how can we encounter depression in patients who have contracted HIV or AIDS. So that is the end of the section. Thank you for watching sqadia.com.